As the reducers, we have a week-long plan set up that you will be using to lose weight with your diabetes. Through the different days of the week, you'll be working different parts of your body individually so that you can lose weight and get fit. And on weekends, you'll be meeting with me, your athletic trainer, so that we can track your progress and see how you're doing.
Our goal is to help our patient lose weight while keeping his diabetic needs in mind. The dietary needs is the key to losing weight as a type 2 diabetic is to maintain a healthy ratio of protein, carbs, and fat. This would be 50 to 55% carbs, 30% fat, and 10 to 15% protein. You especially need to watch the carbs since they break down fat first. Pay attention to your blood sugar as you lose weight. Low blood sugar is common when diabetics lose weight because of cutting calories and weight loss affect blood sugar levels. You'll need to alter your insulin and medication based on your meals and exercise. The meal plan. For breakfast, an example would be a breakfast muffin and coffee. For lunch, a ham and cheese sandwich, corn, and tea. And a snack could be a clementine with water. Dinner would be grilled cheese, broccoli, strawberries, and low-fat milk. Hydration is important for losing weight as well as maintaining diabetes. Drinking Gatorade before and after each workout will help replenish your electrolyte balance. Drinking water and unsweetened tea will also help with hydration.
I'm here to talk about our 25-year-old type 2 diabetic patient and how we can help him reach his goal. One can be by supplements, by using these types of supplements to supplement other foods. Some of these include chromium, magnesium, omega-3, ginseng, indium, and glucosamine. And these will help lower the blood sugar and other roles to prevent him from reaching his goal.
I'm Clayton, and I am the exercise physiologist, and I will be conducting tests on our patient to monitor his health and make sure nothing is wrong. Since our client has diabetes, one of the most important things to watch would be blood sugar, and this will be done by using a portable electronic device that will examine a small drop of the patient's blood. This can be done at home and should be done twice a day or more, and normal levels should be between 80 and 120 milligrams per deciliter. Anything outside those ranges should be monitored. Okay, since our patient is overweight and will be exercising, blood pressure is also an important thing to take into account. Blood pressure is taken using an inflatable cuff and should be between 120 over 80 millimeters per, I don't know what it is.
Just keep going.
Okay. If it is much higher or lower, action should be taken to bring it back to normal. To keep track of the patient's overall health and weight loss, a body mass index test can be done, which just monitors how much fat he has based on his height and weight. This is done by normal BMI is between 18.5 and 24.9 for a male of his age, and wait, is it a female? Male of his age, and that would be the goal. Right now it's probably higher than that, but that's the goal. Okay, another test that we can do to ensure health would be the maximal oxygen uptake test, which is basically just a test where you have the patient exercise. And
as the athletic trainer, I will help you with tracking your progress and tracking your medical records to make sure that you are properly getting your exercise weekly and that it's keeping up with your type 2 diabetes. Throughout a weekly plan, we will work all the different muscles in your body. We'll work the cardiac muscles of your heart so that you can pump more blood and faster. We'll work your leg and calf muscles so that your lower body can work better with your upper body to get you around. We'll work your upper body so that you can lose weight in your upper body and your upper arm strength is stronger. And we'll work your abdominal muscles so that we can lose the most weight in that area. Our plan addresses several different systems in the body. It addresses the muscular system through how the workouts will work the muscles vigorously, making them stronger and losing a lot of weight on the muscles. It'll work the skeletal system because due to weight loss there will be less pressure and build up on the muscles, constricting their movement, and the skeletal muscles constricting their movement. It'll work the respiratory system as the lungs will have to work harder and faster to pump out more oxygen, and with less weight they'll be less constricted. The cardiovascular system will be worked because the heart will become more worked and again can push out more blood and faster. It'll work the urinary system, not a whole lot, but it will affect it in that with the diet you will have more healthy food going in and coming out of your urine. It'll work the endocrine system probably the most, and it's what we'll have to watch the most because of your type 2 diabetes. We'll have to monitor your insulin intake and output and your glucagon. And the nervous system isn't going to be worked much, but they'll be less restricted when the weight is lost.
I'm Carter Wolf, the physical therapist for Team Reducers. Our patient is a 25-year-old man with type 2 diabetes who is wishing to lose weight. In order to do this, he must follow a specific exercise plan. In this plan, the muscle groups that will be targeted are the abdominals and the muscles of the legs and arms. The abdominal exercises include crunches, leg raises, and twisting crunches. The legs and arms will be addressed by doing exercises such as squats, push-ups, and bench press. In order to prevent injury while doing these exercises, there are a couple things that are very necessary. First, you must warm up before every workout. This gives your muscles and the surrounding tissue a chance to receive enough blood and nutrients to perform the desired task. After warming up, make sure you stretch out your muscles in order to increase your flexibility and minimize the risk of injury. Also, you must stay hydrated before and throughout your workout. This will ensure that your muscles have good energy to support the work that is being done to them. Lastly, avoid overtraining and make sure to take at least one day off throughout the week. This will give your muscles time to rest so that they're ready for the next workout.